/case count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We saw one 3-day trend of red flags. However, we have not seen any red flags in the past 6 days. While we are still representing this benchmark as red due to the 3-day trend we experienced, the lower volume of new case counts we have seen over the past few days is encouraging. That said, we know there could be the possibility that other factors are at play regarding delays that could be contributing to this low number, but we are not aware of any specific issues at this time. We've asked the State Department of Health to see if there's anything they are noticing that could be resulting in lower new case counts. We hope to see this lower volume of new cases turn into a downward trend, but in order for this to happen, everyone needs to continue to follow the 5 core actions everywhere you go. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of tests conducted for Knox County residents and another for average time between specimen collection and lab report data. From the data, we can see the trends are heading in the right direction. The number of tests conducted continues to trend up, and the lab turnaround time in our community remains consistent. As a reminder, the data we are reporting for this benchmark is from the previous week, so we can always make sure we are looking at a full week of data. This is encouraging and why we are representing this benchmark as green. As we mentioned last week, we are working with a new lab for our internal testing and are seeing improvements and getting results much quicker within 48 hours. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished that for all of our cases and contacts. Because of this benchmark continues to be represented as green. We will now go a little bit out of order and skip to the fifth benchmark, as Dr. Gray from UT Medical Center is here on behalf of our regional hospitals to talk more about what the hospitals are seeing in just a minute. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows reported deaths of Knox County residents by date of death. This benchmark is represented as red because we have seen a statistically significant increase in deaths. Nearly half of all of our COVID-related deaths we've seen in Knox County have happened within the past 14 days. As always, our thoughts and prayers are with the family and friends who have lost loved ones. And our fourth benchmark, healthcare system capabilities remain within current or forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. For this benchmark, the traffic light is yellow. We did experience some statistically significant increases regarding positive patients, ICU, and ventilated patients. After speaking with our local hospital partners, they stated this benchmark should be represented as yellow. The hospital systems continue to meet daily, assess the situation, and plan their response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. And now I'll turn it over to Dr. Gray, the Chief Medical Officer at UT Medical Center.
Thanks, Charity, and thanks for the opportunity to come back for another monthly update from the hospital systems. I really want to take time to pause and really acknowledge the collaborative effort within the community, not just between the hospital systems, but between all members and sectors of our community in slowing the spread of COVID-19 and being fluid and being willing to pivot and adjust as we've seen fluctuating rates of disease in our community over the last 6 months. So again, I would just want to say thank you for your partnership in doing that. As just in keeping with a similar format from my last updates, we'll start statewide and then quickly narrow to a regional and local perspective and talk a little bit about the hospitals. As Charity mentioned, from a statewide standpoint, since I was last here last month, we've seen a significant increase in the number of new cases per day, but that trend has really changed over the last 10 days, where we've seen some flattening in that rate of increase. Overall, throughout the state, 7.2% of tests are positive. That's up slightly from 6.1% 1 month ago. The death rate overall in the state, though, is down to 1% of overall positive tests, down from 1.2%. Over the last 2 weeks, the percent hospitalized, the percent in the ICU, and the percent of positive folks that are ventilated those curves have been flattening. We have 40% of hospitalized patients who are in the ICU, and of those, 50% are ventilated statewide. Overall, we continue to do a good job statewide in testing compared to other states. In the Knoxville region, which is an 11-county region that we look at, we've also had a steady rate of increases of new cases. Right now, we're seeing about over 100 new cases per day in Knox County and over 300 new cases per day regionally. And again, those curves are starting to flatten somewhat. The death rate is about 0.7%, which is better than the state death rate overall. Hospitalization is maybe a shining light in all of this. We peaked 2 weeks ago or 10 days ago at about 192 hospitalizations for the region. As of yesterday, we only had 158 hospitalizations. 40% of those were in the ICU and 2/3 of those were ventilated. And again, we've seen a slowing in the rate of new cases, hospitalizations, and slightly in the death rate over the last 10 days. Another number that we talked about last month was the number of hospitalizations that you could anticipate from the number of overall new cases. For every 1,000 cases last month, we anticipated 50 hospitalizations. That number is now down to 44, again, to be celebrated. We continue to be aggressive locally with testing as well, with 10% of our tests being positive, which is down from 10.2%. And just one note, those tests are PCR positive tests. Those are not antigen tests. Those are PCR positive tests. And there's been some question about, do we think those numbers are inflated? You know, those tests, PCR test is the most accurate test. We validate those tests internally at each of our health systems, and we feel that the PCR test is the most reliable, giving us the least number of false negative tests, and we can anticipate that the false negative rate is less than 5 per 1,000 tests performed. Now more about the hospital systems. Again, hospital systems, I want to reiterate that they are safe places to be for COVID and non-COVID related issues. We are not overrun with COVID patients, as you heard before, 153 hospitalizations as of yesterday. As Charity mentioned, we are meeting daily now to look at our total capacity and really strategizing as a group of systems over this 11-county area. We have all of the systems every day at 1 o'clock looking at available acute care beds and also available critical care beds and ventilators. We continue to meet 2 times a week for strategic planning. We're continuing to screen our team members and our patients, obviously wear face coverings, restrict visitation to 1 visitor. Our testing portfolio capacity and turnaround time continue to improve slowly. We continue to cohort COVID patients away from our non-COVID patients. And as Charity mentioned, our surge capacity is considered yellow, and our PPE supplies and our supply chains are continuing to open up slowly. One plug for the Medic Regional Blood Center. Medic's platelet capacity and COVID convalescent plasma volumes are extremely low. This is an opportunity for me and for the media to help me to encourage and get the word out for the need for donation of convalescent plasma for patients that have been COVID positive and have recovered for 28 plus days, and for platelets. And both of those can be donated on a more frequent basis than whole blood. If you are interested and a candidate, please call the Medic Regional Blood Center and schedule an appointment for a donation. That number, I have it here, 521-2658 or 524-3074. So in summary, we've seen a positive improvement over the last 10 days in all of our trends, new cases, hospitalizations, and deaths. However, we cannot drop our guard. We should remain vigilant. We should continue to practice the 5 core measures that the Knox County Health Department has espoused for the entire COVID pandemic, and also limit the size of your gatherings as represented in Charity's example with the birthday gathering. We hope we are approaching a plateau, but we don't know that that plateau is on the horizon. There are variables out there that are unpredictable, i.e. school starting, and also the Labor Day weekend approaching in just a month, which is just a month away. Again, I want to thank the community members for their continued collaboration and participation and allowing the health systems to give an update on a monthly basis. Thank you.
Dr. Gray, quickly, we have a request if you could repeat the medic phone number.
Oh, I'm sorry. So I have 2 numbers, 865-521-2658. And the second number is 865-524-3074. And for those of you that want to approach them online, it's medic, medicblood.org.
Great, thank you, Dr. Gray. Go ahead and type your questions in, and we'll have Charity and Dr. Gray answer some questions now. If you have a specific question for either Charity or Dr. Gray, please make that known in your question. The first one we have is from David with WBLT. He says, is it true that most of the spread doesn't happen at bars and restaurants, but at grocery stores and other big stores?
I think it's impossible to really say any of that for a fact. I think that grocery stores and other stores where you're in and out, there's probably a little bit less inherent risk because you're not staying for a long time. You're not interacting with individuals for a long time. You're kind of walking through, getting your things, you're checking out for a short amount of time and leaving. Bars tend to be more inherently risky due to the activities that happen in them. So people are in close quarters. You're there to socialize typically and talk to each other and interact. You're drinking. You can't have a mask on when you're doing that. All of those things put a little bit more risk into that category. You can see that on CDC's websites and others that are looking at that. You know, what we're seeing is the social gatherings wherever they are, whether they're at home, in the bar, in the club, or not in the club, at workplaces where you're letting your guard down and not practicing the 5 core actions routinely. That's really where we're seeing a lot of our clusters, as we've talked about before.
David's follow-up question is, and Charity touched on it here, but if there's anything else you want to say, he asks, do you know from contact tracing what places do we see the most spread? Parties, bars, restaurants, stores, or somewhere else? And possible ranking of them?
I don't have rankings, and we are working on getting more information on how our clusters break down to you guys, and hopefully we'll have that to you soon. But again, I think what I hit on is a lot of it is related to that individual interactions with each other in various settings, and it runs the gamut. And so even when we have seen, as I mentioned on Monday, restaurants, for example, it's typically around the staff members at the restaurants, not as much hearing the patrons saying a single restaurant, for example, that kind of thing. Are people going to restaurants and we're hearing about those? Yes. Are they going to bars and we hear about those? Yes. But we haven't had a convergence of clusters at a single location or type of facility.
All right, I'm hearing that might be hard to hear me asking the question, so I'll speak up just a bit. The next question from Brian Hornback, in regards to bars and restaurants, are they supposed to have a limited number of patrons based on the square footage of their facility space?
I would refer you to the Tennessee Pledge. So right now, bars with the recent Knox County Board of Health order should be closed in Knox County. And then I would refer you to the Tennessee Pledge for the guidance for restaurants at this time. I don't want to misspeak, and I have not looked at that in a little bit, but that guidance for restaurants is spelled out there.
The next question is from Vincent with the Sentinel. You said at the last press conference that you would look into providing anonymized cluster data.
We're working.
Any word on that?
We're working on it. Yep.
The next question we have is from Grace with WBIR. Why is KCHD's hospital benchmark from a 16-county region? If Dr. Gray and the Board of Health look at an 11-county region, how is the 11-county region hospitalization peak higher than the 16-county region peak that you all have reported?
I'll talk a little bit about it and then let Dr. Gray slide in. So the Board of Health looks at our benchmark data, which does have the 16 county regions, and that's based on public health and healthcare coalition regions. 2 of those counties don't have hospitals, so that's where a narrowing down happens as well. So they're looking at that. And then Dr. Shamia is providing information on the 11 county MSA medical service area region that UT works on. So I'm going to let Dr. Gray talk about that, but they are seeing Both of those. Hertz is 16 counties. Yes. So it's Knox County and the surrounding 15. Those include hospitals from the Covenant systems in all of those counties, which I believe we have listed on our website, the Tenova hospitals, and some independent hospitals as well. The majority of those are participating in what the group that Dr. Gray looks at as well. He's double checking his numbers, his county numbers as well. But I do know that I believe UT's medical service area is a little bit smaller typically. In their region of the data that they can see fully on their end of things. But there is definitely both pictures presented to the Board of Health. You ready, Dr. Gray? He's double checking.
This is THA COVID numbers.
Okay, so THA is what they're getting theirs from. So we will, Tennessee Hospital Association, do you want to slide in, or we can follow up as well with what those 11 counties are?
We'll follow up.
Does that work?
Yes.
Okay.
Okay, we can move to the next question. This is also from Grace with WBIR. As a part of that surge plan, could adults be hospitalized at Children's Hospital?
Do you want to address that, or do you want me to talk?
So yes, adults, there is capacity, or we have looked at capacity opportunities at Children's Hospital to house adults. Obviously, those adults would be co-located. And we've also looked at a specific demographic of adults. If there is a need to transfer adults to Children's Hospital, and again, we're not talking about necessarily COVID patients, but just to make space for COVID patients on our campus, those adults would likely be younger adults, i.e. less than 25 years old.
The next question also for you, Dr. Gray. This is also from Grace with WBIR. She said, you mentioned plasma donations are needed. Can you speak to whether that's developing as a real treatment cure?
Yeah, the data is probably too early to tell for sure. And looking at it retrospectively, a year from now, we'll probably know that. But it does seem to improve symptoms and limit disease course. And so all of the health systems have adopted plasma for a certain criteria of patient, and also remdesivir, the antiviral drug. We are doing that on protocol, and that protocol is being shared throughout the systems. But for those that are watching this that don't know about convalescent plasma, again, those are antibodies that have been generated by folks that have been infected with the virus and who have recovered, and it's thought to help mitigate or limit the symptoms associated with newly infected COVID patients.
The next question we have is from Vincent with the Sentinel. It says, last week, Dr. Shamia mentioned in the Board of Health meeting that he was seeing early evidence for the mask mandate's effectiveness. Do you believe the slowing of new cases in recent days is another indicator of this?
I think that we're hopeful that it is, and you know, that can be also there's lots of things that can contribute to it, but we are hopeful. That was kind of the message that we had going into today, is that we're cautiously optimistic. Do we know for certain that this is a trend that's going to continue? We don't at this point, but we really want everybody to continue to do the 5 core actions, and don't take your foot off the gas just because we're seeing some positive data that's happening right now. Absolutely need people to continue to do that. Also, I'm going to take a minute real quick and go back and mention there could be differences in numbers on the hospital data based on when it's grabbed that day. So to get on that as well, we'll get you the county numbers also, but want to mention that's a snapshot on when we're grabbing those numbers. So I could have grabbed the numbers for today at a different time that Dr. Gray did, and there could be different reporting numbers at that time. So a slight difference in there is normal, and from what we see and report on versus what they see and report on, just to make sure everybody understands that. Next question, sorry.
The next question we have is from Grace with WBIR. Knox County Schools has now pushed school back another week. What would it take for you all to advise them it isn't safe to go back in person?
You know, we're really going to be looking at the data very closely, and we talk to them every week, and we'll make those recommendations to them. Again, we don't rely on one single benchmark and one single data piece. We look at all of them together, and we'll advise based on that. And then also based on what Tennessee Department of Health and the Tennessee Department of Education recommends as well for any guidelines on those recommendations.
Next question is also from Grace with WBIR. One study from Yale and Harvard says the safe reopening of college campuses would require students to be tested every 2 days. Is that something you are looking at as UT students move back to campus
Mhm.
starting this weekend?
UT actually has a plan, a surveillance plan in place, and I would refer you to them to talk about what their plans are. We don't speak about individual plans, but they are looking at ways to keep an eye on what's happening on campus with their students.
Her follow-up question was, do you expect the demand for testing will increase beyond UT's health center as students move back?
Again, talk to UT about that. They have lots of plans in place and would have preparations and backup plans for if their primary capacity is exceeded.
Next question is from Vincent with the Sentinel. With respect to taking your foot off the gas, do you believe enough time has occurred to judge the effectiveness of the bar closure order?
Oh, that's just was last week. So I do not think so at all. We definitely need at least a couple of weeks, probably 2 full incubation periods at a minimum, which would be 4 weeks, to even begin to have an idea if there's impact there due to incubation period for this disease.
Next question from Grace with WBIR. Can you explain how the testing benchmark is green? For the Tennessee Department of Health, Knox County reported 12% fewer tests than the prior benchmark week. The positivity rate for that same week is at an all-time high, 9.83%.
So we don't look at positivity rate for that benchmark, first of all. So that benchmark is looking at what the capacity or what the amount of testing that's being done and how long it takes to get test results back is the design of that benchmark. And we have seen, we look at, and this is what we mentioned as well in the benchmark data the previous week. So we have a full week. So you might be looking at what's happening now. And there could be a delay. We haven't pulled up the past few days. So we looked at the previous week and we are seeing we had seen a continuous trend up there. And in that time frame, we saw the time leveling off instead of increasing for turnaround time. So that's where we came up with that. And we had seen that trend for about 3 weeks in a row. We had kept it yellow because of our concerns with the stability issues, as we mentioned last week. But seeing that same trend for 3 weeks, we felt good about making that a green right now, seeing things are moving in the right direction.
Next question from Grace with WBIR. How does kchd handle results from antigen tests? Are they included in the testing benchmark? And if so, how?
They are not included in active case counts. So an antigen test, so the only thing it is a confirmed case, according to the Tennessee Department of Health's case definition, is a PCR positive case, period. Probable cases can include antigen positive tests that also have clinical symptoms to go along with it. So you have to have a clinical picture that looks like COVID and the positive antigen or any other antibody testing to go along with that. We see very few of those at this point right now. We are starting to see more as there's more of that type of testing happening in the community. But again, the gold standard and all of our confirmed cases are PCR positive cases.
Next question is from Brian Hornback. Can you speak to Governor Lee's statement about the future release on COVID data from schools?
I cannot. I know what you saw in the media yesterday. We haven't received any additional information at this time.
Let's see. Grace from WBIR asks, are antigen tests included in your testing turnaround time?
I'm having to think on that. I do not believe so. No.
From Vincent with the Sentinel, he says, I think Grace is trying to ask if antigen tests are included in the testing benchmark, not if they are incorporated in probable cases.
Yeah, so I will verify with our epidemiologists who are pulling the full data set. I do not believe that those are in there, but we'll double check and we'll let you know if we're wrong.
From Grace with WBIR, a 10 News viewer wants to know whether places of worship should also be considered as risk spots currently in the community.
Places of worship can be risk spots in the community, given that you're gathering there, and a lot of times in close contact, there's a lot of social interaction in those areas. All of those things that can put you at greater risk for being exposed to this disease. So with any social gathering, it can be risky in those situations. Are we seeing a lot of things associated to clusters or anything like that associated to church groups right now? No, it would be the same as what we're talking about with our other situations we're seeing.
From Grace with WBIR, another viewer question, asking why the case numbers for Hispanics was 716 yesterday, but today are 691. Was it a correction in data, error, or something else?
I honestly don't know, and I'd have to go back and look at you. We can look at it and we can follow up with that. It might have been transferring some cases out or some data cleaning that happened.
Also from Grace, we've heard again and again that deaths are a lagging indicator. Can you explain what that means? How much of a lagging indicator are they?
I might get the good doctor to help with some of this. Really, it takes time. So you have to be exposed to the virus, and then it can take you up to 2 weeks to develop the disease and then test positive for that. And then there's a couple of days for testing to come back. And then once you've become ill with the disease, it takes some time for you to have worsening symptoms that would lead to hospitalization and or death. Do you have the exact number, like what y'all are saying? I think it's 3 weeks total. We'll let him speak.
So I agree. So incubation period from exposure to onset of disease or symptoms can be, as she talked about, 2 to 14 days. Hospitalization can then range another 7 to 10 days, and then another a week and a half to 2 weeks after that, before a death is experienced. And obviously, that range is very, very widely. For folks that are hospitalized and don't succumb to the disease, the average hospital stay is 8 days. For those that ultimately die from the disease, the hospital stay is usually longer than that. So again, significant delay from exposure usually to death, and that's that lag that we're talking about.
All right, time for just about 1 or 2 more questions. One last question, WBIR says for Dr. Gray. We've seen Knox County hospitalizations seem to stabilize or trend down. How does that look for the surrounding more rural counties? And how do the surrounding county cases impact Knox County?
So, and honestly, I'll go back and say, that's why I look at the county, whether you're looking at 11 counties or 16 counties, it's pretty hard for us as a hospital systems to look at just Knox County, because we serve Knox and the surrounding, for UT Medical Center, is the surrounding 21 counties. And so we look at those collectively. And also I will say that, again, we collaborate as a group of health systems within the region that extend out for most of those 21 counties. And so what you see from a hospital capacity standpoint is what we're all experiencing. As we've talked about, we're going to surge horizontally and not vertically. What that means is that we're not going to allow one hospital system to get in trouble and be overwhelmed. That is why we have daily capacity calls. Actually, they happen at 1 p.m. and we decide who needs help, if anyone, and we make arrangements to help them with capacity, help them with equipment, whatever they need, what remdesivir, plasma, whatever it is that they need. No one hospital system will be overwhelmed, and the impact will be felt horizontally across systems.
All right, it is after 1 o'clock, so thank you all for joining us. Thank you, Dr. Gray, for joining us today as well. We will see you all for the Friday media briefing at 12:30. Have a good rest of your day.